Tommy, let me jump back to you for a second. Audrey mentioned earlier it would be nice if we had an Angie's List for CRO selection. So if I was going out to pick an electrician or to find a babysitter, I can just go on there and look at reviews and see who people liked and who they didn't like and why and all that. Unfortunately, we don't really have that in this area. You can look at companies who have won awards in the past and things like that. And obviously, if you're looking at a CRO and trying to decide, are they going to be a good fit for us or not, you can talk to folks within the company who have worked with them before, maybe go to some of your network connections, see what any of them can tell you about this company, maybe even go to their website and look at what's out there as far as experience and so forth. But other than that, are there other ways that you have of judging a CRO and deciding if they're a right fit for you or not before entering into an agreement?
Yeah, I mean, I think we encounter all the kind of business development reach out from multiple vendors, including CROs, on a constant basis. And there's so many providers out there, it's really hard to narrow it down. And I think I think you hit on a key one, is network. I mean, as big as we feel this industry is, when you really start digging in, you can usually connect people within a couple of different, connections, whether that's through LinkedIn or other social media aspects or previous projects. But, I think, you shouldn't rule out, if you have strong KOLs or investigators that you trust, their experience in the area and past experiences with CROs. I value that, because at the end of the day, the CROs are going to be engaging with the sites and they're representing your company, and you want them to put a good face forward. And so if investigators have had a bad taste in their mouth with the CRO previously, and you select that CRO, you need to be prepared to navigate that and have that conversation and help that, investigator and site understand that this is going to be different. But I think they can be a valuable asset in understanding, they're ultimately the customer that's going to be engaging with the patient and recruiting to your trial. And if you make a bad selection decision, it can make the difference of not only quality in the trial, but also recruitment to your trial. But I think, really a key factor for me, and, when our teams kind of dig into this due diligence, is transparency and trust. And I think those are really effective, measures to whether or not it's going to be a good partnership. And I think a CRO who's willing to admit their weakness as much as their strengths as part of their due diligence effort is really a key component. I mean, having an honest conversation during the bid defense or even up front, with the key stakeholders that you're going to be, working with at the CRO, to say, where do you see gaps in our process or the risks, with this development plan or this project, and do they align with the ones you've identified internally at your company? And if not, why? And I think we've all sat down across the table for multiple CROs, and each have their own delivery, some more polished than others. But at the end of the day, do they really understand where the rubber meets the road, if you will, as far as your project is concerned, and the critical success factors, and whether that's recruitment, retention, whether it's data quality, whether you have a complex endpoint, maybe you're using a technology that's really, novel, getting a sense of how comfortable they are with that, the willingness to lean into you and your experience, can make the big difference of a successful partnership long-term.
And I think the next question kind of goes in line with that. So I'm just going to stick with you for another moment. A lot of folks will tell me how important it is that the CRO they select have the same culture as what they have within their company. And when I think of all the things you could consider when selecting a CRO, do they have the global experience? Have they worked on a large trial? Do they have experience in my therapeutic area? Have they worked with companies like mine before? There's so many things you could go through, and I'm thinking, culture, how does that even fit into it? But if you were talking to a company, is that important to you? And how do you go about determining what their culture is and whether or not it's going to be a fit for you?
Yeah, absolutely. And again, I think, in the situation that we're in, particularly as a smaller company, it's important to understand what role you're asking the CRO to take on and how that cultural fits. Are they going to be an extension of your team, or are you, handing over pretty much all operations to them and just going to kind of monitor from a distance? And, that's a key aspect to the selection decision. And some CROs are best positioned to take the baton and run with it and just touch base periodically and really kind of operate independently, without a lot of, intersection and oversight, whereas others, welcome that partnership and that involvement. And again, become an extension of your team. And that speaks to culture and how they operate. Are they process heavy? Are they, separated into a lot of different functional areas with a lot of management in between you and the people on the ground doing the work? And how does that fit with how your organization functions? Because when you encounter issues, you want to be able to escalate those issues quickly and get resolution. And if there's a lot of layers to go through and your company functions in the same way, you need to take that into consideration in how that's going to impact the success of your trial and the issues when they arise. And so, from my standpoint, we are an organization that likes to be fully partnered with the CRO and again, really leverage them as an additional resource. We want to invest them in what we're doing. We want them to understand, the complexities of why we're doing the trial and what it means, whether it's from a regulatory strategy or a patient-facing strategy, and really have them buy in to the key aspects that are going to make the trial a success, where it's not just, hey, we need you to go provide the service. We want you to understand, our mission and our vision of this project and, have you feel that. And as soft as that sounds, I think that goes into culture. And, you can kind of get a sense of that through your dialogue with the CRO in the early stages. Is it going to be a collaborative fit? Do they seem open to that partnership? And I think that needs to really go into your selection decision in regards to understanding, again, the culture and how you operate. Do you want to be able to pick the phone up and get that person that's at that site on the phone? Or do you want to have to go to that manager? And really understanding that dynamic is key.